I'm Mark Neve, Chief Diversity Officer for the Association of American Medical Colleges. Welcome to our Diversity 3.0 Learning Series. We are very pleased to bring you this set of online resources, a source of insight from experts in the field on a range of issues which you tackle day to day. We've created these resources to help you leverage diversity and inclusion to drive institutional excellence. The AAMC is committed to serving as knowledge brokers, offering you the best content generated from within our network of relationships with thought leaders and practitioners. With this series, we bring this learning to your desktop or device for on-demand learning that suits any schedule. Visit us in the future for additional content, and thank you for watching.
Hi, my name is Jaeyoung Yang. I'm a first-year medical student at the University of Pennsylvania. I'm here today to talk about my experience working as a project manager at the Camden Coalition of Healthcare Providers. I learned a great deal through this experience, and my hope is that through this presentation, I'll be able to share with you how diversity has been integral to our work. So a little bit about my background. I was an Econ and International Studies major in college. After graduation, I worked in health policy for a year. I decided to go into medicine. I did a postbac, and while applying to medical school, I worked for a year at the Camden Coalition. So Camden, it's a city in South Jersey, about 80,000 people. It's a challenging city to work in. It's poor. About a third of the families live under the poverty level. It's dangerous. It has one of the highest homicide rates in the country. It has minimal levels of education attainment. About 40% of Camden residents do not have a high school diploma. And there are language barriers. About half the residents are of Hispanic origin, so Spanish is important. The healthcare system. So there are 2 hospitals and 3 ERs, as well as 15 to 20 primary care offices across the city. There's little coordination across these different settings, just in terms of discharge planning or health information technology. There's also high utilization relative to the national average, according to data by the Dartmouth Atlas of Healthcare. So the coalition, it began in 2002. In the very beginning, there were 2 studies that drove our work. First, there's a study where we took the billing data from the 3 hospitals and overlaid it across a map of the city, and we realized that there's high levels of concentration of healthcare costs and a relatively small level of landmass. We also found in the second study that about half the city residents go to the emergency room, often for causes that are preventable and can be handled in the primary care setting. After these studies, the founder of the Camden Coalition started reaching out to the hospitals and other doctors to figure out what the healthcare system can do to improve these disturbing trends. So 10 years later, we work on a variety of projects. We have a care transition team where we help recently hospitalized patients get adjusted to life back in the community. We have a diabetes collaborative where we invest resources into primary care practices and help them track and manage chronic conditions. We also have a health information exchange where we facilitate information sharing between the inpatient and outpatient settings. We've gained approval from New Jersey to develop a community-based accountable care organization. And we also recently won a CMS Innovation Grant to implement and improve our care coordination activities. So this next part of the presentation, I'd like to talk specifically about how diversity has strengthened our ability to execute our mission. The problems that we face, high healthcare costs, low continuity of care, these are systemic problems. And in order to solve them, it's essential to have the different stakeholders all represented at the table. And it's a principle of our organization to have the hospitals, the primary care providers, behavioral health specialists, and other healthcare professionals and community representatives to sit at the table and talk about these issues and reach a collective plan that we can all implement. We also think that it's important to learn from other industries and other disciplines and incorporate these diverse ideas into our work. Our founder was inspired by what the NYPD did in the 1990s, where they used data to figure out where crime was occurring in the city, reorganize their department to better tackle these challenges and even measure performance. And we hope to accomplish similar things with our health information exchange and use of data as well. And in doing our work, we realized that the patient plays a large role in their health and healthcare. And we knew next to nothing about how to engage them in this process. So we reached out to our friends and community organization specifically an organization called Camden Churches Organized for People, to learn lessons and work with them to figure out how to work with patients and get them more involved in their health and healthcare. At a unit level, all of our teams have a variety of perspectives. We have healthcare, we have business, we have legal, we have data analysis. And each of those perspectives adds a new angle to the problem that allows us to develop new and innovative solutions. This last portion, I would like to talk about the different surface learning programs that the Camden Coalition offers. I think organizations like ours can be conduits through which medical students can gain exposure to learn what it means to work with underserved populations. We have summer internships through a program called Bridging the Gaps that gives health professionals and social service students an opportunity to see what it means to work in an underprivileged setting. We have a year-long service opportunity called AmeriCorps, where we have pre-med and medical students come in and work with our care teams and help patients transition into life outside the hospital. And we also have a couple fellowships where we have young doctors come through and work with patients and also do research to try to get them excited, get them involved in our projects. Again, my name is Jaeyoung Yang, and I've really enjoyed my time working at the Camden Coalition. I think it's taught me a lot about working with people who are different from me and working in an unfamiliar environment, and also trying to make a difference in the care provided to underprivileged communities. And I would definitely recommend anyone with an interest in these matters to actually spend the summer or a year going out and actually working to try to make a difference in these areas. Thank you.